I'm Steve Edwards, and I serve as President and CEO of CoxHealth, and we want to give you another update on COVID and our response to it. I know that in our community there's much anxiety, and I was speaking to my children last night, and I was reminded that I get to see a lot of inspiration what's going on in our community, and that's comforting to me. And so I want to share today some of the things that are inspiring us and some of our more particular preparation plans. Preserving PPEs continues to be the most important thing we can do. So what are we doing? So shutting down non-urgent elective surgeries and procedures is a big contributor to this. And why is that? We use a lot of PPEs in non-urgent elective procedures. We also have patients that need recovery time. They need ICUs and ventilators sometimes. So this provides more space, more ICU space, more equipment, and getting us more prepared for a possibility of a spike. Our employees are making important transitions in their jobs. For example, we shut down the Meyer Center for again, to create distancing for our community. Jack Mezarowski, and you can see in this photo, is one of our check-in people for visitors in the hospital. Jack is a former Olympian. Try to get by him. We're so grateful for people like him making that difference. This beautiful woman, Madison Lanier, she isn't cleaning chairs, she is saving lives. Our whole housekeeping environmental services team is working extra time to make this hospital and our services more clean than ever before. So what are we doing internally? I want to focus on a couple of those things. There is a lot of innovation going on that we have to do, especially around things like PPE. So Scott Rogers and our team have worked to create a prototype of a face guard with Jordan Valley Innovation Center. We're going to be able to print that through 3D printing, cut it through laser printing, and crank out 5,000 at a time. We're also looking at converting HEPA filter into masks. Our volunteers are sewing masks. Our engineering department has rapidly crafted plastic protective screens to, again, all this to save PPEs, to protect our staff, protect our patients. Inside Cox, I can't begin to cover the amount of inspirational things I'm seeing going on in our organization. First and foremost, I want to talk about Dr. Trotman. He's our infectious disease director. He's Wake Forest trained. He is our LeBron James. He's a leader of our efforts, and I'm really, really confident in him because he has seen what's going on in both coasts earlier than the CDC has, and we're making changes quicker than most hospitals in our region. I'm really proud of his leadership. We have an incident commander named Karen Kramer. She is our Florence Nightingale in an Avenger cape. She is leading this incident command team, and all the logistics and planning and day-by-day changes going on are led through she and her team. I'm especially grateful for our leadership that we find in our county with Clay Goddard. Clay is a stalwart leader and is pushing us more aggressively than many communities, and we're way ahead of the curve in terms of making those changes in our community. Others in our community are rallying behind us that I find inspiring. The Discovery Center reached out and said, you know, do we need daycare for healthcare workers? So they've agreed to work with us and Mercy and other community healthcare providers to create daycare opportunities. They actually need some support, so if you want to support the Discovery Center, make a donation would be wonderful. I know the hospital will support them as well. We know that for a long time, Cox and Mercy have been competitors. Today we find ourselves as absolute allies. I am especially grateful for the leadership of Mercy. Craig McCoy and I are working together on almost a moment-by-moment basis. When we try to do something, we try to do it together as a community, working with the health department and also working in places like Jordan Valley and Burrell. That leadership makes a difference for our community. I'm really grateful for all those leaders who are working together in a united fashion. I just spoke with our board chairman, Chuck Challenger, and he agreed that we will contribute another $1 million to our Employee Assistance Fund. We know our employees are going to go through a lot, and there will be difficulties they're encountering while they're here at work. They're worried about their family at home, and so this fund has been set up to additionally support our employees in that way. So what we need from you and our community, continue to focus on social distancing and stay home. The new data is beginning to reflect that about 40% of hospitalizations occur in people between the ages of 20 and 40. So those that thought they might be invincible, you're not. You're still at risk. The good news in that sense is there's very few fatalities associated with people of that age unless you have other really complicated comorbidities. But we also need you to stay home not just to protect yourself, but protect those most vulnerable in our community. Please stay united, please care for each other, and please care for our community.